Universal health coverage is a human right that belongs to everyone on this planet. No matter who they are or where they live, everyone has the right to access quality health services without facing financial hardship. This was the historic commitment made by the United Nations member states in the political declaration made at the first ever high-level meeting on universal health coverage last September. The UNAIDS Executive Director Winnie Byanyima, in a message on Universal Health Coverage Day, says, quote, "On Universal Health Coverage Day, I stand in solidarity with all people who lack access to the health services that they need. Today, 10,000 of those people will die. Every 2 minutes, a woman will die giving birth. And every second, 3 people will be pushed into extreme poverty, paying for health care. Today, those with the greatest need for healthcare are the least likely to get it. This must change, and it must change fast." End of quote. Well, in Nigeria, the National Health Insurance Scheme, NHIS, has been tasked with the goal of enhancing access to quality and affordable healthcare for all Nigerians. Historically, health insurance in Nigeria can be applied to a few instances: free healthcare provided and financed for all citizens, and healthcare provided by governments through a special health insurance scheme for government employees and private firms entering contracts with private healthcare providers. The question on the minds of many is healthcare accessible and affordable? These and other questions will receive answers shortly. Our focus today is on Family Action Plan and universal healthcare. I am Dennis Adigunloye. Welcome to Nigeria Today. And with me in the studio to further speak on Family Action Plan and universal healthcare is Dr. Oladimeji Olayinka, Director, Primary Healthcare System Development at the National Primary Healthcare Development Agency. You're very welcome to Nigeria Today, sir.
Good evening, viewers, and good evening.
All right, and also in the studio we have Semiye Michael, Executive Director, Dean Initiative and Country Coordinator for World's Largest Lesson SDGs Activation. Welcome also to Nigeria Today.
Thank you so much. Welcome, viewers.
All right, let me come to you first, Dr. Oladimeji. Let's begin with achieving universal healthcare coverage. What really are the issues?
Thank you. Achieving universal health coverage actually is described as a system where every citizen has access to healthcare package, whatever is defined as the package for the country, be it basic healthcare package at a cost which is affordable or at no cost at all to the individual.
All right, Shemi, let me come to you. Just shed more light for us on this Family Action Plan for universal healthcare coverage.
Yeah, basically, we're looking at a system that's going to, just like Mr. Olayinka said, that whatever the package a country describe or develop will be accessible and be affordable, and in most times will not even be without costs based on the value each country places on the human life that lives within their borders. What we're going to continue to do based on the type of work I do is also to pinpoint the role that family sector plays in ensuring that we own the structure together that enables both the government and the society at large build the kind of health system that works for them. Because most times this whole system has been left for the government alone, assumingly that it's practically 100% the responsibility of the government to do most of these things, both in provision, in maintenance, and in even providing source for funding. But the structures has to change to look at what roles government have to play, what roles the private sector have to play, and what roles family structure also have to play. Hence, the need for the nationwide sensitization around, you know, the roles of individuals, especially the family structure, on what to do in assessing the type of healthcare delivery that we want.
All right, Dr. Olajimeji, just give us your take on this need for a multi-sectoral approach to healthcare.
That is correct, because it is not possible for government alone to deliver holistically healthcare services to the people. Even though in Nigeria we have that kind of division that is like a 3-level healthcare service system, whereby we have the tertiary care being directly funded and supported by the federal government, and the secondary healthcare is supposed to be by the state government, and the local government takes care of the primary healthcare system. However, because of constitutional provisions that actually lumps finances of the local government together with those of the states, the responsibility for delivering primary healthcare services are actually with the state also. And that means that for us, all sectors must come together to deliver health. Because when we talk about health, everybody thinks about hospitals, doctors, nurses, and so on and so forth. But we know that for complete well-being of people, you need good food. And to get good food, you need good agriculture. And agriculture, for agriculture to be good, there is need for good money and sciences to go into that. There is need for good water, and that means you need Ministry of Works, Ministry of Water Resources. We need good environment, and there are ministries in charge of that. And also, apart from government, there is need for private sector to come in and partner with government to deliver on all of these services.
So, as things stand at the moment, you feel that these other, ministries that you've mentioned need to, do more and maybe step up to the plate. Is that what you're saying?
I would rather say we need to work more together, collaborate with one another, because everybody is doing at best what they know how to do within their respective powers. But I think we could achieve more if we had to work together, if we could work together and set common goals.
All right.
That would be.
Okay, Shemia, let me come back to you. What would you say is Nigeria's status currently in terms of universal healthcare coverage?
Unfortunately, we have to face the reality. It's not. It doesn't look good. Specifically, the system that produced this NHIS, it was meant well. Unfortunately, it's not achieving the result that would be desired. We look at what is happening across the globe and we match it with what's happening here. So the argument always has been, we are not so-so country, we are not so-so country. But what's wrong in us being so-so country or so-so country? So there is a huge dichotomy in terms of synergy. Like Salanika said now, the cooperation is not strong. There's intergovernmental, relation. There's huge kind of personal competition within the structure of government that works based on the people that lead some of this structure, and it's difficult to address when you are in government, because the fear of, if I say this can be, and the parochial system around bureaucracy that makes change very difficult within the government sector needs to be broken. So when we study how government in other countries develops, there are a lot of technical aspects that are not put through the strenuous structure of the bureaucracies that have been created within the government sector that slacks progress down. We can't have the kind of health system that people are dying every day. You can see the statistics. People even query most of these statistics that no, the World Health Organization, they just may raising an unusual alarms or this, but it exists. We see them you go to the hospital, wait for some time, you see the number of cases that are recorded. The reason is simple. Okay, we need to provide the minimum balance. Even the NHIS is not even covering all health-related issues. You get this type of the sickness, they say no, it doesn't cover it. And the people, you know, the balance is still huge, and we can't deceive ourselves. We need to scale up and be more, you know, 21st century leadership in tune to find a way of addressing some of the things that we need to address, that other parts of the world are keen into and developing daily.
All right, Dr. Oladimeji, having said all that, achieving universal healthcare by 2030, how feasible, how realistic is it?
It is possible, because it depends on the determination. Because in Nigeria, we have the resources. We have partners who are willing to support us where that doesn't seem to be adequacy. But we need to just get our acts together so that we can march towards that goal and get there. For us in government and in NPHCDA, over the years, what we had been focusing on is getting infrastructure in place, building more health facilities so that people can access primary healthcare services. And after some time, we started trying to eradicate polio, and we did that for a number of years. And we thank God that by March, by the first quarter of next year, we're looking forward to certification of Nigeria as being polio-free. And so now we're focusing on actually delivering services to the people at costs that will not be catastrophic in any way. So what we mean by this is that right now we have a two-pronged approach. The first one is implementing the revitalization program of the federal government, and the second one is the PAC under one roof, which seeks to put primary health care under one roof at the state and the local government level. And I think if we can implement this, and of course, maybe we have time to talk about the Health Act's provision of the Basic Healthcare Provision Funds, because delivering services is one thing. Getting people to have the financial power to access, to purchase these services is another thing. And that is what the Basic Healthcare Provision Fund seeks to address.
All right. Goal 3, Semia of the SDG talks about health, obviously. What's the action plans in place currently to achieve this?
So, Goal 3 specifically look at the holistic approach of good health and well-being in general. And that has to do with a lot of the health infrastructures. For us, some of the things we are looking at is we've complained a lot as a people, and sincerely we need to start facing some of the realities that works for other parts of the world. We've complained so we're building a mass, citizen-centered campaign, and that's why working with government is one of the best things that we can, possibly do to make the citizens understand. We're launching what we call the National SDGs Family Activation, where every family in the country will see where their own role actually fixing in creating a system that will work for all. We want to see how we can look at what type of primary health care will work in Zamfara that necessarily will not be the same that will work in Lagos. And who are the people responsible in providing this local, healthcare system? We look at the local government, just as Zalenga has said. Unfortunately, people still find it difficult to hold local government accountable in Nigeria. The reason is simple. We don't have local government, we don't have the opportunity of electing our leaders at the local government level in Nigeria. So, apart from the FCT, where the system of autonomy for local government is still at the, is working, every other state in Nigeria do not have that opportunity. The state governors, it's at will. They decide to either hold or not hold. So, in addressing this, we have to to find a real balance in the political system that will allow citizens contribute meaningfully. And before we can contribute meaningfully, democracy has to really work at the local government level, because these are the level where the primary health care center becomes closer to the people, and the people who administer this system also, they are the closest to the people. But when they are not elected by the people, it is difficult to work with them and design a system that will work for the people.
All right. Okay. We'll take a quick break now. The topic is national primary health care and improving universal healthcare coverage for citizens. But let's take a break now and hear from people on the streets on what they think on this issue.
They are very close. At least there's a Gariki I'm living in the 7. The primary health is there. The government are trying.
I can't say it's a trackable distance, but the distance is not as long as what one could say. Maybe it is a very long distance. At least it's accessible. Actually, I'm not using the primary health center, so I wouldn't be able to judge their service.
The distance is not that far, and it's very close to where I stay. Based on the scale of percentage, I think I'll give them 60%. If they can improve on the services, and as time goes on, I hope they can still do better.
Like the government hospital there, the place I'm staying is far. Like you can enter motor like 150 or 100. For me, I normally go to private.
A medical center close to my house. Primary health care center around my area. I don't know anyone around my area. I've not used it before, but I know people do go there, and I think it's okay.
There is no single primary health care within the radius of that environment, as far as I know. I'm rating them very, very low.
Primary healthcare facilities or hospital around, they are not enough. This primary healthcare issue, the hospitals supposed to be just every locality.
All right, welcome back to the studio. Our topic is universal healthcare and the Family Action Plan. Some thoughts members of the public there. Dr. Oladimeji, you heard some of the comments made from some members of the public there. They're not too, let's say, happy with the frequency with which they're able to access primary health care, especially in the, let's say, rural areas. What's been done to, change this narrative?
Okay, that is what I referred to as the revitalization program of the federal government of Nigeria. Mm-hmm. This program was initiated a few years ago, was flagged off by His Excellency President Muhammad Buhari. And that program seeks to ensure that every political ward in Nigeria has one functional primary health care center. One functional primary health center means that that center would have good infrastructure, will have access to all the supplies they need, and above all, we have adequate manpower to man the facilities. And then it will be a range of services that they will deliver, including laboratory services for that health center. Mm-hmm. So far, about 4,000 have been refurbished, kind of talking about infrastructural upgrade to some of these facilities. Like I said, we are working with the federal government. Yeah. And the role of National Primary Healthcare Development Agency here is to support. We actually are legally empowered to provide programmatic and technical support to the states. So occasionally, where available, we source resources from donors and even from government to support the implementation. However, the responsibility for delivering primary healthcare services and doing all of these things are at the doorstep of the state governments and the local government areas. However, the good thing is that the enthusiasm displayed recently by the state government is unprecedented. Now everyone is really anxious. They are ready and willing to provide these services, maybe because as a result of pressure from the people or because of increasing response of governors to the yearnings of the people. We have seen state governors approaching us, asking us to come and support them and show them the way to go about how can we rapidly transform this system that is not functioning into a very effective and highly efficient system. And then we're running along with our partners to them, and then we're doing whatever, we're doing our best to ensure that this dream of having one functional PAC center in the world is achieved.
All right, Shemia, the issue of cost of getting healthcare is always a challenge in Nigeria. What is being done as far as you're aware to address the cost of quality healthcare?
So the judgment of either access, costs, for us, we've always argued that it should not be looked at from the perspective of report from people who live in the, in state capitals and in the city places, because the majority of our people in Nigeria actually live in the rural communities, and a development agenda that is, that is not inclusive, bringing in mind the people who go to farm every day. These guys feed us. If they stop existing today, there's every possibility that we are not going to last any longer, because these are the guys who power the food, system of the country, and they live in very hard to reach rural communities. When we provide services in any context that these guys do not enjoy or have access to, either in terms of cost or availability, then our development agenda is still very porous. And see, the federal government is trying. Let's leave that aside. But the real thing is, there is nowhere in the world where the government at the center actually solve the problems of the, that exist at the grassroots. They only provide an enabling environment and a structural leadership that allows people at the grassroots, the government, either at the local government or at the state level, to do what is right. Unfortunately, that is not what we have in Nigeria. It is highly costly in the rural community. In fact, it's not even available. I work in the rural communities. I have, in FCT alone, I've visited more than 400 rural communities where life is almost more like a drama. I'm not even talking of Zamfara or your state. I'm talking about the federal capital. We have well over 900 rural communities that surrounds us in FCT. And then when you visit these communities, that's when you begin to imagine. So when federal government have plans of, like it said, of one functional primary healthcare center in wards, for instance, the plans are good, just like all the plans we've always been having. But the problem is, who monitors if these activities or programs are actually implemented the way they should be implemented? My organization track government performance at the grassroots level, for instance. So there are a lot of things that are done. We work with the investment, these social investment programs, school feeding and stuff like that. We're providing them feedback, because the grassroots,
that is where the real crux of the matter is.
Because they can be measured, which is not happening.
All right, Shemia Michael, Executive Director, Dean Initiative, and Country Coordinator for World's Largest Lesson SDGs Activation. Many thanks for your expertise and your insights on today's topic.
Thanks so much, Nigerians, and we keep making progress one step at a time.
Sure. And Dr. Oladimeji Olayinka, Director, Primary Healthcare System Development at the National Primary Healthcare Development Agency. Thanks also for your expertise on this topic.
Thank you. I believe we are making progress. We're moving towards achieving universal health coverage with all efforts, including community participation. I believe we'll get there.
We surely will. All right, and to our viewer, thanks for watching, and remember you can watch this edition or any other on our YouTube address on your screen, youtube.com/NTA News 24 Hub. I'm Dennis Adigunloye. Many thanks for watching, and we'll see you again soon.